Your social media feeds might be flooded with hair care trends to fix age-old issues. And this Wellness Wednesday, we're going to focus on that, but not for the ladies this time. No, we're focusing on the guys. So let's bring in Surgeon Dr. Cory Torgerson to let us know more about it. Good to see you this morning. Thanks for joining us.
Hey, Steve. Good morning.
So listen, I mean, we're not lying. You go to TikTok or anything else and you see like so many hair care tips, right? But the guys get left out a lot of times. So what is it that we need to know?
Well, first of all, hair's a big deal, and guys are finally ready to talk about it. You know, there's more embracing of good hair than ever before, and there's solutions.
Here's some of the solutions that are more popular, because I know you hear a lot about transplants, but unless you're in the know, you don't know much about what that entails. What does it entail?
Well, the first thing to know is, why are you losing your hair? And you know, Steve, about 80% of men on the planet have the most common kind of hair loss called androgenic alopecia. And we know that as male pattern baldness. So most hair loss is male pattern baldness. And when you have that, that means that you're going to lose hair specifically from the top of your head only. And it's caused by a sensitivity to a hormone, an androgen hormone called DHT. So here's what you need to know. There's two issues. One of them is that we want to stop losing the hair. So we want to block the DHT, and there's many ways that we can start early to keep our hair. Things like finasteride, which is a DHT blocker, PRP, which are growth hormones from our blood, or even cold laser. The other consideration is, what if I've lost so much hair? What do I do? And there's really only one way to fix it with real hair, and that is a hair transplant. And there's some exciting new sort of innovations.
I want to get through as much as we can in a short amount of time. With the hair transplant, how much time do we have to dedicate to that process?
Just depends how many hairs that you need. Usually the most that we'll do in one day is about 2,500 hairs, and most people need about somewhere between 4,000 to 5,000. So that's usually a two-stage process, so over about 9 months. So probably about 1 to 2 years. I'm your best friend by about 9 months.
And let me ask you this as well. You know, a lot of people, and I know that I think the stats are like 1 in 4 men will start losing their hair by the time they're in their early 20s.
Yeah.
At point typically will people come see somebody like you, or should you be concerned maybe that it's you're losing it at a faster rate, I guess, than others, or than you would want?
Yeah, when you have the gene, some people have a super sensitive version, and some people have a moderate, and some people have a mild. So the when that you start your hair loss is more related to your sensitivity of the gene. So if you're losing in your 20s, the biggest thing to do is stop losing it. Do everything that you can to keep your hair, some of the ways that I've said. But a hair transplant is not off the table if you're losing it early. Most people come when it's kind of like, you know, mostly gone. We have some scales, but, you know, some of the pictures that you're seeing are the typical when men generally start to engage. The age isn't the issue, the stage is the issue. But my big message is, stop losing hair early.
Stage, not age. Good to know. We're going to have to leave it there for now. Hopefully we can catch up again at some point in the near future. Thank you, Dr. Torgerson. Appreciate you joining us this morning.
It's my pleasure. Great to be on.
All right. Thank you very much. Stay 22, Jeanette.
Cheers.